Welcome to Between Two Pastries, everybody. This is Nicole.
Hey everyone, it's Annie.
Today we have our second oncology dietitian joining us today. We had an amazing interview with our previous one. Welcome, Mandy. We so appreciate you being here, and I'm going to let you introduce yourself.
All right, thanks so much. I greatly appreciate the invite, and I'm super excited to be here sharing some knowledge bombs in the oncology field, as I call it.
What,
So,
what? Absolutely.
right. So, as mentioned, my name is Mandy. I am a registered dietitian. I've been one for a little bit over 5 years. Actually, been with Ascension for 5 years.
Wow.
Yeah, going strong.
Good.
Didn't start in oncology though. I was inpatient and then I
Oh, yeah.
transitioned to outpatient. Oncology, the opportunity knocked and I just grabbed onto it. So yeah, so I've been working in the oncology field. I'm full-time outpatient, as I said. When I'm not in clinic, I absolutely love getting outside, kind of practicing what I preach. So I
Sweet.
am constantly outdoors. I love climbing mountains, so I guess
Oh,
kind of
cool.
behind me.
Yeah,
So
love that though. Those
Yeah.
are really
Did
cool.
you make
Yeah.
those?
thanks. I did not. I
Oh,
wish
all
I
right.
did.
Yeah.
No.
It looks like, you could like play it up like, oh yeah, those are
Right? I'm like, that's
Yeah.
another talent.
Those are
wish I
original.
did that.
Yeah, I wish. No, definitely always over on the Pacific Northwest a lot of time and then Colorado. So doing a lot of
Sweet.
14ers.
Yeah.
Um, yeah, big volleyball player and a kickboxer. So that's kind of my little sports stuff on the side.
Nice.
But
Very nice.
oncology
Cool.
definitely captured my heart. So here to
Mhm.
share all. So I think I'll kind of dive in with the fact that I actually work at two different oncology clinics.
Mm,
So they split my time between two. I have two very different patient populations because of that.
mm.
So one of mine is up in Brookfield, and then the other one is in Wauwatosa slash border of Milwaukee.
Sure.
So it's been nice to have a variety of people. I'll kind of give a little bit of rundown on, I suppose, what my like day to day sort of is in clinic. I meet with every single new patient in house and I check in with patients who are currently on treatment. That just actually depends on side effects, type of
Mm,
cancer. And then, sometimes I'm meeting with people, I can push them out a couple weeks. And sometimes I'm meeting with them like at least once a week. It just
yeah.
depends on how their body reacts. That's the kind of thing with, I guess that's the unique part about oncology, I'll say, is that there's no, can't be a cookie cutter in this field. You got to kind of ebb and flow with what's going on, and
Hmm.
that's one of the, I think, the fun things for me, as well as one of the tougher things, because you can't really
Yeah.
follow there's no like script here. You just kind of got to tackle a pretty serious thing head on and make it the best for people as much as possible. I also do see any patients that come in to see the oncologist as well as the radiologist. So I both of those treatments are in my clinic. So it gets kind of busy because they're on different
Mhm.
levels, but
Yeah.
work it as best as I can. I think, just in general, I discuss the nutritional material at face value, starting with what patients can maybe see once they begin treatment
Hmm.
in terms of
Hmm.
nutrition, how the best way
Mhm.
is to start them off on the right foot at the beginning. And then I get the necessary information, kind of similar to an inpatient dietitian, where I need those, what's your regular eating pattern? In this field, I actually am really careful. I do not use the word diet.
Good for you.
I just think
Thank you.
there's a lot of things that come with that word. So I actually
We
always
know
call it
it.
eating
We
Yeah.
pattern.
know it, sister.
Yes,
An eating
there.
pattern. That's exactly right.
Yeah.
Eating
Yeah,
pattern.
it's an eating pattern.
Not a big fan of that word.
Mhm.
So yeah, so I'm always really referring to it as eating pattern in this arena, because you never know. I mean, someone could come in and they want to be eating, but maybe they have had prior experiences with other, XYZs with diet. So I just try to keep it out the doors of my clinics.
Perfect.
So get
Amazing.
the information I need right away out of the gate. And then most importantly, I tell my patients that I try to keep things simple. Everything in oncology can get pretty messy and
Mm.
pretty complex. So, in my opinion, I'm biased, but I think that keeping nutrition simple makes it just easier, and not
Mhm.
and even
Yeah,
outside of the nutrition field too. It
totally.
just keep it simple. Just follow simple guidelines. No one ever wants to
Yeah.
believe that, but I wish more people would understand that.
I know. I
It'd be a
find
heck
that
of a lot easier.
too.
Yep.
Gosh. Yeah.
I know.
People
So,
make it so hard on themselves. Yeah.
they do
Hmm.
100% everywhere.
Yeah.
So yeah, so
Agree.
I remind them I'll keep it simple, and they do actually, breath. Okay, sounds great because everyone's
Mm,
all worked up initially at everything, of
yeah.
course, understandably so. And I think like if I were to describe myself in my clinics, I like to call myself the ray of sunshine for each patient on like their darkest days. They get this terrible
Nice.
diagnosis. They're trying to process everything and they're trying to do everything by the book, but at the end of the day, they're really missing something. So I try to get them to smile at least once every single interaction I can, and I consider that a win for me in this arena for sure. But
Yeah.
I just remind them, nobody walks alone with this fight, so no one even is going to walk in complete darkness either. So ray of sunshine, trying to come through when I can with the nutrition piece.
That's absolutely fantastic. Yeah. That
Do
truly,
you see
truly is.
adults and kids or
you
just
know
adults?
just adults.
Mm.
Okay. Okay.
Yep.
Is there a kids, or would that just all go to children's?
That my best guess on that would be that would go to
That all
children's.
okay.
Yeah.
So Ascension
Hmm.
in general, blanket statement, just does adults with oncology. Okay.
Yeah.
Just
Yeah.
curious on that one.
Yep.
So
Awesome.
one of the first things that we're just going to kick it right out, and we did with the other dietitian as well, is this whole myth around sugar feeding cancer, even causing cancer, and how everybody's just so like, oh, we have to eliminate it, we have to eliminate it. What is your approach on that as well, and how do you? Because I know you hear it, you of course you will, because it's everywhere. So how do you handle
Yes.
that?
Mhm. Yeah, absolutely. I actually do hear that probably, I don't know, maybe not necessarily on the daily, but anyone starting new, especially with breast cancer,
Mhm.
Okay.
um, kind of like to tag oh, I know I shouldn't eat sugar, Mandy. And so then I actually
Mm-hmm.
like stop it like right away because I'll let them, say their comment and then I'll just interject instantly because I don't want that to run any choices in the kitchen, anywhere they're eating
Mm-hmm.
something. So it's definitely a hot topic in the cancer field. I think it will forever be just due to the misinformation out there on social media. Unfortunately, there's a lot of bloggers out there. There's a lot of people who have gone through cancer treatment themselves and eliminated all sugars. I often question that also because sugar is in naturally a lot of
Yeah,
foods,
because it
fruit.
should be, because if
Alcohol they drink, the
yeah,
wine.
Yep.
yeah, I
Yep.
mean, we kind
So,
of require it.
they run across Betty, who did I cut sugar out and cured my cancer. But, so I just remind people when you're looking for especially nutrition information out there, please, please, please go to reputable sources.
Yeah,
So, American Cancer Society, fantastic, always
Yes.
pushing my patients there. Otherwise, if they're looking for that nutrition piece, I do say, please look for someone with the letters RD behind their name,
wonderful.
and I explain what that means. And I also allude to a nutritionist really necessarily does not have to have any education to get that
Right.
title. So trying to clear that gray area for
Yeah,
the
no, that's
misleading stuff.
fantastic. And so, oh, sorry, go ahead, Annie.
Yeah.
No, I was just on that. Do you feel, I mean, as you're just stopping patients from, diving into how they're not going to eat sugar, do you feel like there's a battle with medical doctors, providers,
Uh,
and stuff that they, the first thing that comes out of their mouth is, well, we could eliminate sugar and do this,
right.
like they kind of give a blanket statement dietary line, and really now it's combating with what you're saying ultimately.
Yeah, so I think it depends on the physician for sure. I do see a lot of that in-house, inpatient. I am forever grateful that my oncologists pretty much stay in their lanes and they refer to me.
Ugh.
Amazing. Um, so yes, I think too, it's unfortunate because I agree with the statement to an extent. So I'll digress into this a little bit. So sugar being found in many foods, and I don't stop my patients. I definitely talk through this with them too, and I give them a handout that I have prepared. But I remind them sugar, added sugar is actually what we want to be aware of. So not
Mm-hmm.
just sugar, it's the
Mm-hmm.
added sugar. And
Right.
so I allude to research actually has not supported that eating just sugar will cause cancer or make it worse. And it actually hasn't supported that it will stop or make cancer
Precisely.
shrink. So
Precisely.
Well, but
there's both.
here's the
Precisely.
problem is adding an apple
Oh,
added
gosh.
sugar. But see, this
Realistic.
is the thing, Nicole, is
Right.
everyone thinks
The
that
mentality.
if there's sugar, then I'm adding that in. And this is where, we kind of overlap with that disordered eating piece.
Yeah.
Mhm.
Everyone interprets, they don't exactly understand how to read a label. And if they do, added sugar, we're avoiding. And well, I'm going to do one better.
Mhm.
I'll just not eat sugar. Do you
Right.
see what I
Yeah.
mean? This is the tumble that people go.
Right. Well, and people don't, they don't have access to someone who can explain that. Right. And so I kind of
They
go
have
a
the
little
internet.
even further, right? Like the internet is terrible. I hate it.
Yeah.
Yes, we do
But no,
too.
I definitely, I kind of explain like the whole concept of like the added sugar is more so because sugar increases empty calorie intake, right? So then we're providing our body with like excessive calories potentially,
Less
reducing
nutrients. Yeah.
nutrients
Yeah.
exactly.
Yeah.
But there's, and I think too, like people they need to understand that there's no difference between white refined sugar or like brown
Yep.
unrefined sugars.
Yep.
So,
Sugar.
sugar, right? So the effects on the body, the same. You're going to have possibly an increase in body weight if you continue to overindulge or insulin levels go out of whack.
Right.
So, I explain to people going back to that apple comment. Yes. So I explain the difference where there's natural sugars with an apple, but then we're looking to like eliminate foods like cakes, candy,
Right.
cookies, sweetened cereals, sodas. So those are like the added sugars that I'm warning people about over consuming, not having to like completely eliminate. Nothing's ever black and white, even in oncology, but higher sugar intake can lead to overweight, obesity. And then the concern that I wish physicians would go further into isn't causing cancer. The concern is the obesity is tied to so many other diseases, heart disease, diabetes. And so we start going into a trifecta. That's the main concern there. And I just, I think people too need to remember that all cells in our body, cancer cells or not, they need glucose. Glucose being sugar, being
Right.
carbohydrates,
Yeah.
another thing that gets deemed as a bad guy.
Yeah.
They use
Totally.
it, I mean, our bodies use it as fuel, as that energy
Right.
source.
Yeah.
Yeah. I
So
mean, just
we're
to
not
sit, to be
feeding it.
awake. I
Yeah.
mean,
Yeah, we're
But
not feeding it.
I,
No
I think
functioning.
I think what's really important though for people just to hear again is the whole concept, because this is what we've gotten away from is, people are so obsessed with, this is a slight digression, but yet these people are coming in with this mentality, right? Where it's all about either a reduction in size or eating less when we forget that we still have nutrient requirements. So, in regards to the added sugar piece, it's just constantly reminding people that it's like, okay, if we're doing all of these things over here, we now have taken away from our body actually receiving the things that we need to feel better or to tolerate treatment. Or, and again, it's not saying let's not do these things, it's
Mhm.
let's make sure though that we have like all of this other stuff here too.
Right.
It's that whole nutrient connection that is just so important.
Well, and
That's
you're right, you're
that's the
nailing it.
important thing. It's not like,
Exactly.
it's like we don't care if you want a piece of cake. I don't care. It's not going to hurt you. Nothing bad is going to happen. It's like, and where are some of these other nutrients? So yeah.
And I
well,
do
and
tell my patients too, I'm like, please eat. So, I mean, especially when someone is having a poor appetite from treatment, I'm like, okay,
Oh my
please
gosh.
go eat high calorie
Yeah, whatever
foods. And
you
I'm
can
like, ice
tolerate.
cream, please.
Yes.
So there you
Yeah.
go, like sugar, but you just nailed it. It's about
Mhm.
the whole eating pattern. And that whole
Yeah.
eating pattern needs to be rich in fruits, vegetables, whole grains, all have sugar, some form of
Totally.
sugar in it.
Yeah.
And that's a prevention that's been supported by American Cancer Society to include all those. So
Forever. Yeah. Yeah. Completely. You
well, and
know,
I think,
oh,
wait,
yep.
let me really quick. I think,
Yeah.
and correct me or stop me if you feel like I'm wrong or you disagree. I think we have to remember too that case by case, if someone is overweight or obese, their health, they might be in perfect health outside of having cancer. They
Correct.
might,
mhm,
not having their weight might not be an indicator for health in that way. You might have someone who is super thin and you know what I mean? Like sometimes our size doesn't necessarily,
No.
determine
right.
what's going to happen. So like,
No.
and sometimes depending on our situation, we may or may not have to add in more or less, like you were saying, high calorie
Mhm.
things. It's just,
Yep.
it's kind of like this case by case. So to, to have, and this probably gets old for you, similar to, diabetes educators and cardiac dietitians, where it's just everyone comes in and says, well, I can't eat carbs anymore because I have,
Right.
right, or I can't eat fat anymore. And it's like, let's take a step back.
These
Yeah.
extremes.
Who are
Yeah.
you? And let's look at your situation case by case, and not worry about the fact that you're overweight. I feel like underweight is more critical to,
Yeah, for sure.
9 times out of 10. But, let's look at the whole picture. And that's what I think people forget about more often than not.
Yeah.
So
100%.
Yeah, and I always do turn it toward, like you just said, it's not about eliminating things from your diet, it's about adding things to make it more nutritious. So
Yeah,
that's usually the
absolutely.
turn I take with people.
So one of the things that we didn't get to with the previous guest that we really wanted to tackle, because this is another really big hot thing, is in regards to breast cancer and the consumption of soy. And again, there's so much confusion for the consumer, not for us, but for the consumer around the use of soy in general. So just kind of wanting to see where you stand on that and how you help people navigate that.
Yeah, so that's another one that, I'll let my patients have their opportunity to have this discussion with me and voice their concerns. But ultimately, American Cancer Society has some really great information debunking, I'll say that as well.
Yep.
Mainly because, when risk comes into play of increased breast cancer with soy, it actually has been supported that soy foods, so the food sources, I'm not talking about supplements, but the food sources, they reduce the risk of breast cancer in women.
100%. And we know that.
Right. So it's the other side to it. But I do remind my patients that those soy supplements, on the other hand,
Yeah.
they generally tend to get real gray area just due to higher levels of isoflavones. So, that comes into play,
can you
which
give
are
an
found in
example for
soy.
people?
Yeah.
Like
When you're talking
what
about
a soy
supplements. Yeah.
supplement
Yeah.
would be?
Yeah.
So, the isoflavone that's in the soy, it's an estrogen, essentially, a plant. It's a plant estrogen. So it's higher level in what I would say, like a supplement would be like a protein, a soy protein powder, for
Right.
instance. So
Yeah.
whatever is processed, not in its original form,
Yep.
like not a food form, right? So I'm,
Right.
in terms of like one of my favorite snacks, actually, full disclosure, I love edamame.
Hello.
So
Me too.
great source of protein.
Yep.
That's another thing, and fiber.
hmm
So the soy products can have some really good nutrients, kind of bringing that back into play.
Yeah.
That fear kind of creeps in and could stop people from getting those from. I mean, soy milk is another good one. Actually, has
Yep.
a really good amount of protein to it.
Yes.
I push my patients more toward that when they tell me they're wanting to do almond milk for protein. I kind of have to educate again on that.
Yeah.
But in tofu and tempeh. So, there's a lot of very good soy products. So we kind of talk through the fact versus fiction, I'll say,
Yeah.
and try and minimize that fear. And then, of course, kind of actually give them a little pat on the back, though, too, at the same time, because they're being precautious. But it is, again, that supplement, protein powders, pills, whatever form is not the original food form. Anything that has been manipulated
Right.
is something to be concerned about.
Yeah, yeah, and I really hope people hear that, because again, soy is truly a great thing, and it's hard to watch people just stand around fear with food, or fear with foods that they ate, especially they're like vegetarian or something. So,
Mm-hmm.
um, and then I guess moving kind of with that too, do you have different protocols that you do with different forms of cancer? Would there be a different protocol for lung cancer versus, something with like the
GI.
gut? Yeah, exactly. Colon cancer. Yeah.
Yeah. So, I think when it comes to the types of nutritional interventions that I do for, I'll take it at a broad spectrum first. There's a lot of different ones according to side effects from treatment, but I'll go into that second.
Yeah.
In terms of different nutrition for different cancers, two of them actually stand out big time to me. One would be colorectal, colon
Yeah.
cancer, rectal cancer, and then pancreatic, actually. So
Oh, big.
those two, colorectal, usually I am just reminding patients to reduce intake of the red or processed meats.
Hmm.
Now, I say reduce because, again, I'm not a black and white person. I'm never telling anyone to take 100% of anything out of their eating pattern. I don't support that. Um, but those two, red and processed meats, have been proven to be risk factors for those specific cancers. So keeping intake down, since we already would have a diagnosis at this point of seeing meat, would be just really important for that. And processed meats being like your sausage or your bacon or your deli
Yeah.
meats.
Yeah. And you know, when again, I only bring this up because I know how where the listeners are going, right?
I got to
So it's
stop
like
eating those things.
that's correct. So it's kind of like let's talk about what that really
What does a
means.
risk factor mean?
Right, because
Yeah.
when I know when I'm working with someone, I specifically talk about the amount of exposure, and things like this. So when you're maybe giving recommendations or trying to educate someone around that, how, again, what do you say?
Yeah, so I go with the recommended amount per week, and that is 18 ounces.
My
Real life examples,
Which
I
is like
love it.
huge,
goodness.
Yeah, it's a lot. So that's why I'm like, don't eliminate, right?
right?
Oh my
So
God.
size of palm, it's roughly
Yeah.
like 3 ounces, right?
Yeah, three
Yeah,
to
there.
four,
So
depending. Yeah,
yep. So I would just say ballpark it. And I tell people that gives you at least a good, like, if you want to split it with three, that's a good 6 ounces three
that's like
times a week.
massive, though.
It's a lot. So
Yeah,
it's not
Lot.
about completely. Now, that is for, I will say though, I'll pause myself here. That is for the red meat.
sure.
Now, the processed meats, I do say keep it as there's no recommendation because that one
Yeah,
is a little bit higher for risk.
yeah,
So I just say keep it at a minimum. That's
yeah,
at your discretion. Now, to pause, because I'm definitely not saying no red meat. And I actually tell my patients, please include lean red meat. And that's
yeah,
anything with like a loin, great, sirloin, tenderloin, steaks, fantastic. That vitamin B12, so important.
yeah.
Please make sure that red
And
meat comes
iron.
into play.
Gosh,
Absolutely.
yeah.
Just
So yes, it's
getting
no
protein
eliminating
for
anything.
muscle weight.
Yeah. 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 No, and I love it. So I hope people really heard that.
Yes. I mean, I'll keep saying it. Yes. So,
Yeah.
so that's for those two. But then for pancreatic, it's a little tricky. It depends on stage of what the person comes in at. But often the nutritional interventions are very different for them just because of the whole breaking down the food is a little bit complicated because of their
Yeah.
cancer. So I
Yeah.
usually am telling them to eat 5 to 6 small meals or snacks a day. It
Hmm.
just depends on where they're at. Include protein with each meal because, again, trying to maintain that muscle mass if things aren't being broken down efficiently or absorbed as efficiently,
Yeah.
unfortunately. Along with that, I do tell them to eat slower, trying to help that whole process of breaking down the food in the mouth and chew slower too.
Hmm.
So again, just trying to help aid that whole process because something isn't working right. And we don't know, some of my patients do get put on pancreatic enzymes as well, just depending
Right.
upon myself and the oncologist if we think that's a good idea or not. So that, yeah, I would say that one is probably one of the trickier ones.
Yeah.
Just had a new one start who is actually on pancreatic enzymes, who actually she said is working very well. So fingers crossed that continues. So
Good.
the good news
Great.
is there are always options too, with just depending upon. Otherwise, honestly, recommendations for just, I'll say, general nutrition when it comes to cancer, mostly plant-based eating. So I say mostly because, again, I'm a huge protein person. So
Yeah.
please include proteins while you're going toward a mostly plant-based eating pattern.
Hmm.
And that doesn't mean, I'm going to pause because it doesn't mean I want you to all become like a vegetarian or vegan.
Right.
Like, no, please, just overall picture is include some of those really great nutritious plants. All those things that people seek in supplements, vitamins and minerals,
For
fruits and
heaven's sake.
vegetables. Save your money,
Yeah. No joke.
please.
No joke. Well, the excuse
Please.
is I don't like those things, so I would rather eat a pill, you know,
Which,
but
and that's
you're not getting the
unfortunate.
benefit. Yeah.
You're not. And it's not as easily
Nope.
absorbed as the food
Nope.
source. Your body doesn't know how to absorb pills and powders and
Right.
detox teas, etc. So
Correct. Yeah.
Can we
Totally.
argue that a lot of people they hear plant-based, and because the word plant is in it, they just assume, you know what I mean? Like
Vegan, that they need to be
that's all
vegan.
you
right.
eat. Yeah, that's
Right.
the
Mhm.
extreme thinking
Yeah.
and behaviors that are occurring. And that
Right.
again is the problem because plant-based doesn't mean vegetarian or vegan. It just
Right.
you're eating plants
Right.
regular.
Right.
That's
It's like,
all.
Right.
okay, if we look at your plate, how many of those are plants? What percentage is it? Like,
Mhm.
and then that's your base.
But it's also okay if that's not every single day. Like,
That's
again, we have
correct.
to remember
That's
trends and
correct.
averages, not because the amount of guilt that some people feel because they did,
Yeah.
oh, I
Yes.
didn't have a salad with lunch. It's like,
Yes.
dude, neither did I. It's
Like,
okay.
chill out. Yeah,
It
I know.
happens,
Right?
right? Like,
I
totally.
know. And I think too, people don't
Yeah, go
realize
ahead.
how easy it is to add fruits and vegetables
Oh,
Oh,
too. I
yeah.
mean, I'm like, hey, I just talked to a patient. I'm like, you like eating pizza? So how about you toss on some bell peppers on that next time you get your pizza and maybe
Yeah.
some mushrooms? Boom. So you
sounds
just
awesome.
increased it. And it was so simple because you're eating something you enjoy.
Right.
And then you can add some more plants on there.
Yeah.
Right.
I think
Simple.
people get a little hung up with, like, they don't get how small the serving size is and
Yeah.
how
Mm,
impactful. Like, if we're going to talk about a serving, they don't realize that it doesn't actually take a lot to be impactful, you know?
right.
Right.
Yep.
So yeah.
And I
Um,
think too, it plays on the whole like small steps make big impacts, and
Oh,
people just
yeah.
don't want to believe that, but
Yeah.
it can be such a game changer.
That's right.
and
Absolutely.
manageable to
Yeah.
actually make
Yes.
change. That's,
Yeah.
can we really quick, because I've worked with clients before with cancer, in short periods of time where they go for the collagen and kind of the, feeling like that's going to be a cure all for their cancer, not a cure all, not cure their cancer, but they
Right.
need to make these changes. What are your thoughts on collagen, maybe in general, or as it relates to cancer? Are there any links between the two?
No, collagen, I will say, it links to cancer, not that I've seen evidence-based research. However, collagen in its time and place, okay, a natural protein found in foods. So
Mhm.
I actually tell my patients, please, before going and getting that collagen powder and dropping close to probably $50 for a
Right.
container,
Yeah.
the reminder is it's naturally an amino acid, which
Mhm.
is in chicken, fish, and sure, bone broth, of course, can come because I know that's a big one too, but eggs, legumes, and you know what? Even our bad guy of soy has it too. So there's a lot of protein foods that can give collagen as well, and in my opinion, more efficiently. And whenever anyone is interested in that, because some of my cancer patients bring up wanting it for their hair and skin and nails, because
Yeah. Of course.
some
Yeah.
of the side
Of
effects
course.
do impact that. So I would never, tell someone not to include the nutrient, but always food first is my
Yeah.
staple on that.
Well, again, and it's explaining again, these collagen supplements are simply supplements if we can't get in these certain
Right.
sources. And the
Mm-hmm.
other piece too is that collagen isn't a complete amino acid either. So we're kind of missing
No,
out on some of those things too. And again, people just have this expectation of like that it will just make everything so much better. But
it will fix it. But I should say a PSA here because I don't want anyone to hear this wrong either. If your physician or a healthcare professional has told you based on your laboratory values that you have a
Mhm.
deficiency in something and they have prescribed you a supplement,
Mhm.
there you
please
go.
listen to that.
That's a
Yeah,
So,
completely different story.
totally.
yes, I don't
Totally.
want that to hear, I don't want anyone to stop any kind of supplements that you've actually been prescribed. So that's my little my little
Perfect.
PSA on that.
That's absolutely perfect. So, as we're kind of drawing to a close here, do you have any kind of like final words, or if you wanted people to remember one or two things, what would that be for you?
Yeah, so I think I'll put it in two different topics here, titles. I'll do one on like cancer prevention, and then I'll do one in case anyone's on cancer treatment. Prevention, I'm biased, of course, being an oncology dietitian who works actually with our prevention and high risk program too. But my advice is pretty simple: start sooner than later with your preventative measures. I can't emphasize this enough. We're a curative society. Red flags, sirens don't tend to go off until something is actually really wrong. And then
Mhm.
we're trying to fix it
Right.
and backtrack. And unfortunately, I see that. So sometimes it's pretty difficult to fix things once a cancer diagnosis is actually delivered.
Yeah.
In terms of treatment, always advocate for yourself. Something I've noticed from attending webinars is that not all cancer clinics across the United States they don't all practice the same way, don't have the same interdisciplinary team members, and some sites don't even have a registered dietitian present. So
No.
best practice definitely varies, but remember, you are the expert of your bodies, and when something feels off, listen to those cues. If you are having nutrition specific side effects and you have not been seen by a registered dietitian, ask to speak to one at your clinic. Or if you simply want nutrition information, or you just request to speak to one. It doesn't even have to be, side effect driven during treatment. Always use your voice, because health is wealth and you're worth it.
Yep,
Love that.
absolutely, 100%. And then we usually ask everybody that we have on what their favorite food is.
I love it. Simple. I'm a big culture of food fan, so pad thai all the way.
Oh, sweet.
Thank
Yes,
you.
that's really
We haven't
good.
So
had a
good.
pad thai
Yeah.
yet.
Well, the minute you say it, I can taste it. I'm like, oh
I know.
yeah.
Like I'm
So
like
good.
salivating, like, and
I
dinner
know.
time.
Yeah, completely, completely. Oh, that's so great. Mandy, thanks so much for being here. Annie, do you have any last words or questions,
I
comments?
don't have any last questions, but Mandy, well, I guess this is kind of a question. Besides working with Ascension, do you have an outpatient or anything on the side or anything like that? If people wanted to reach out, or certainly we can throw people your way.
Yeah, I do actually. I it's kind of just in general here, but I work with some clients at my gym, and then also I just work on the side with whoever kind of comes my way. So sort of starting the ball rolling a little bit on my own private practice stuff.
Sounds
Do
good.
do you have a website or anything, or we can always post your information as well?
Just send
Yeah.
that to me, and then I'll make sure that that's all in the show notes for
Okay,
everybody. Yeah,
perfect.
awesome. Well, thanks so much for being here, Mandy. We so appreciate it.
Thanks for having me. I had a blast.
Thank you.